Hey everyone, thank you so much for joining us on One Take Live with Monica May. Before we go any further, I do want to say please go ahead and get on Facebook and share this with other people. We want to make sure that they join in the conversation and that they like the content and they can move it forward as well. Our YouTube is Monica May Communications, and of course, now we're on Spotify. March 10th is traditionally Women and Girls HIV Awareness Day. And many years ago, a pastor, Bishop now, Derek McCrae, introduced me to another member of our church at the time, Experience Christian Center. And he said, I think you two women are on the same path. You're doing it from different angles, but I really think that there could be some synergy there. So he introduced me to this wonderful woman, Dr. Andrea Dunn. And we have forged not only a business partnership, but a friendship that has lasted gosh, it's got to be more than 10 years now. And to see where she's going with her nonprofit organization, Let's BeeHIVE or Let's Be HIV Educated, is amazing. And I'm so glad that she can join us and talk about the event that she has planned where we get ready to jump in the beehive and just make sure that every queen's crown is on correct. And she's going to explain all of that to you. Hey, Dre, how are you? Thank you for being on One Take Live.
Hey, Monica. Thank you so much for having me today.
You know, we've been doing the Let's BeeHIVE event, I don't know, for many years now. Let's talk about what we can expect. And we have one coming up March 10th.
Yes, believe it or not, this is the 8th annual Queen Bee Symposium that we have held for National Women and Girls Day. So I'm super excited this year to be able to host it again with you by my side, and so grateful for our friendship and our partnership with helping, bridge the gap with some of these tough conversations. And so this year we are focusing on the theme this year is Bloom Where You Are Planted. Mm-hmm. And we are focusing on women and children who are affected by HIV. And so in previous years, I think it was maybe 3 years ago when we did the Royal Garden, mm-hmm. And we talked about HIV during pregnancy. So now the seed has grown. Yeah. And so how does, HIV affect women and children after pregnancy? And so we have 3 panels of panelist speakers. And so we'll be able to talk about HIV from the child's perspective. And then we'll talk about HIV from the adult perspective, and then also incorporating mental health, and then also having mothers on the 3rd panel sharing their experience on how they disclosed to their children and to family members about HIV. And, this was a common question that came up 2 years in a row on how can mothers disclose. And so that's how this topic came about, through our anonymous question and answer sessions from 2 previous consecutive Queen Bees. And so I'm really hoping that this will, help answer questions and help guide women in different ways. And then also, my goal is to create a family-oriented atmosphere this entire year with our Queen Bee HIV prevention program, and really learning what we can do to, reduce stigma and barriers to care.
That stigma and the barrier to care is what got you started in this. Let's talk about your background as a pharmacist and what really was your driving force to get so deeply involved in the plight to end HIV.
Yeah, so man, it goes back, but
let's go back.
As a pharmacist, there's so much importance with treatment and care when it comes to HIV. And I was given a project to work on what the HIV antiretroviral cocktail was that prevented mother-to-child transmission when I was an undergraduate student. And this was my first real introduction digging into the medications. This was prior to pharmacy school. And that assignment was one of the reasons why I wanted to become a pharmacist, after learning how powerful the treatments were. And I really wanted to learn more about how is it affecting the human body and how does this work? How can, treatment prevent transmission?
Mhm.
And just as a pharmacist, as I went through school at Howard University in Washington, D.C., it was very prominent there. So just being in the environment where I had an opportunity to learn a lot, traveled, worked in various different places, but no matter where I was, it was always, women of color, men of color that was deeply affected by HIV. And so it just really started to hit home, I think, just through
Mhm.
patient care and just me and my lifestyle, just living, that a lot of the women and men who I felt like I was caring for, could have been me or a family member
Yeah.
or someone else. So it was just, and then seeing children born to mothers with HIV was really the I think the driving force, and seeing youth newly diagnosed at 12 and 13 and 14 years old, it does something to you. And so I really just felt the need, and God had just laid it on my heart and, told me this is what he wanted me to do. And it's been a faith move ever since. So, but HIV is treatable. And, that's something that I really want to help with ending the HIV epidemic and help people understand that the treatments do work. And so that's one of the beauties and the excitement that I feel as a pharmacist in HIV care.
Mhm. And you've been very dedicated to this, and there is a drug that you have been really tooting the horn for. And I mentioned to you that I interviewed someone out of the California area that is doing AI in terms of healthcare. And he is not just specifically dealing with HIV infected people, but that is a large population of those whom he has used his AI on. And
Mhm.
the questions that they're able to answer and the chat, if you direct that chat, it is so much more engaging. I don't want to cut out that healthcare person, but it is really engaging. And so I mentioned you. And when I mentioned you, I also mentioned PrEP. And boy, did that start a barrage of just conversation. So I've got to put you, and his name is Raman, I've got to put you and Raman in touch, because PrEP is the next step. And it's evolved even since I met you. It started out as pills. Now it's an injectable. And so, can we talk about what your step into that arena looks like?
Yes. And thank you for
Oh yeah.
being able to connect the two of us. I think that that's amazing. And with technology and incorporating AI, that's really where I see the wave of the future going. We
Yes,
definitely need
absolutely.
to be along that line. So I would love to connect with him. But as far as PrEP goes, we have a prevention program and campaign, and it was She is Prepalicious that we were able to do together when we did our media campaign for this. But
Mhm.
one of the initiatives with this program is to help women understand that PrEP is for them too. I love our LGBTQ plus brothers and sisters who are in that community,
Yeah.
but I feel like oftentimes women and heterosexuals, or even um, sometimes even bisexual women, these conversations really don't come into play as much. And so we really wanted to help women make sure that PrEP is for them too, and also helping healthcare providers know that PrEP is for women too, because those are some of the barriers. And so through that program, we are currently partnered with Orlando Immunology Center, where I'm actually prescribing PrEP through a research study that we are under um, way with BeeHIVE Healthcare. And so with that collaboration, we're actually getting women prescribed PrEP. And I'm so excited that I have a few women already on PrEP, including the injectable PrEP. And it is so, so exciting to be able to, you know, you see a problem, but to be able to implement it and take action to fixing it is two different things. And so that has really been, I think, one of my greatest passions and
Mhm.
greatest um, accomplishments in the last 2 years with this. And we're also helping to identify barriers through research with the Robert Wood Johnson Foundation,
Mhm.
funded through them for their interdisciplinary research leadership fellowship program. And so we're identifying what we can do to remove barriers to HIV prevention, specifically for Black women here in Orange County. And we're in the third year of that research project. So those are areas where we're really trying to focus on why aren't women on PrEP and what are the barriers that we can identify so that way we can take action and actually make change.
And I think one of the things, Dr. Dunn, is we as a people just don't like medicine. We as a people don't really like to go to the doctor. So we as a people sometimes may have the symptoms of HIV, but are too afraid to find out if it's so. And then sometimes we won't take the preventive measures because we don't know how to engage that into or broach that subject with our partners. So,
Mhm.
one of the things that I love about what Let's BeeHIVE does is that it gives you conversation starters, it gives you real talk. And it gives you not only that discussion, but that confidence that you can use with your partner in leading you all to safety. I tell the story, and he does not like it. When I met my husband, we were in our late 50s, and it
Mm.
was very important for me to have a current HIV exam and it be negative. And I mean, and it was a fight. So I understand that. And so I can I'm confident with my conversation starters and my insistence on going to the doctor and making sure that you and your partner are negative. But those are things that we have to introduce at a very early age. And because we don't like to have those conversations, it becomes almost like a cyclical turn the other way kind of situation. And that's what Let's BeeHIVE and Let's Spill the Tea aim to do, because every time I do a tea and there's a discussion on HIV, Dr. Dunn is my lead person for that. So that is the reciprocity that we offer each other. And I think it's important for people to link up with others who are thinking like them and then bring on others who may not or may be a little bit more hesitant. What have you found with the ways that you engage? Has it been helpful to the audiences that you're trying to reach, Dr. Dunn?
Yes, I think so. I mean, I would hope so. Oftentimes, with trying to capture that feedback, I feel like we get it more verbally as opposed to electronically, say with our evaluation forms and everything. But based on the feedback that I've received either in person or through testimonials that we've received on our website, people sharing information with us, it has been very rewarding. Oftentimes, and I'm really glad you shared that story as well with the importance of asking your husband to get tested,
Yeah.
for you to learn that information because in the state of Florida, women above 50 are one of the age categories that
Mm.
are one of the highest ages that are newly diagnosed with HIV. And so it's not necessarily just among our youth or
Yeah.
just among our MSM population or same gender loving male population. And I think that that's one of the barriers, and there's a level of misconception. And so I think, for other people to hear that transparency that
Yeah.
you shared is so important because, and to have the confidence to be able to talk to our partners and to be able to, you know, create a level of safety in the beginning, I feel is very important. And then also when you mentioned as far as like healthcare providers, and one thing that we try to help people in the community understand, and even me as a patient, when I'm on the other side, I've had to learn how to advocate for myself, even when I have another healthcare
Yeah.
provider telling me, no, you don't need to be tested for HIV. No, and I'm like, having to advocate, no, this is what I want. Oftentimes, women may be under the impression that it's an automatic test that's being done
Nope.
outside of pregnancy.
Nope.
that's not necessarily the case. And so there's levels of, that's a part of the education that we really try to help people understand, because you have to know when they're ordering labs, what labs are they ordering, and be really specific, so that way when the test results come back, that you understand those results, and really having full transparency with your provider, and helping increase those levels of conversation, and having the confidence not only to talk to your partner but also to a trusted healthcare provider, and finding support.
Hmm. And that is the key right there. When COVID came about and we were able to take at home COVID tests,
Hmm.
that was one thing. I don't know if I feel the same way. And we've had this discussion before about at home HIV tests, because if that, I don't even know how an at home HIV test would show positivity. But if it's a strip color, just like a pregnancy test or COVID test, I don't know if that would be the case. But I've taken at home pregnancy tests before and needed the support of someone there, because you just need somebody when that strip does turn that color to be there with you. Now, if you don't have that person and it is an HIV test, what have you found, Dr. Dunn, in terms of that? Being, do you support the at home taking of the test? Because don't you feel like you need that mental health support
I
or
do.
just a friend?
Oh my goodness, this is such a great question. And it is still a little controversial, I will say.
Hmm.
So we do offer home testing kits. We actually partnered with Hope and Help last year to initiate a home testing kit program, and we help distribute tests for them through a partnership. And we also recommend that people can get home testing kits from Talk Test Treat, and that's through the health department. And so there's several avenues and several ways of home testing kits. And I think it is very important in the event someone is afraid to go in person.
Hmm.
But that's one of the advantages of having access, or say, I'll never forget, there was one episode in, do you remember? Oh my gosh, I don't know why I'm blanking, but there was an episode in the sitcom that Gabrielle Union did.
Hmm.
It was on BT. Do you remember the
I
name?
do. I remember it and I can see it, but I can't
I
think of
don't
the name
I
of it.
can't think of the name of it. However, there was a scene in that movie where, or in that episode of that sitcom, where she was in the process of dating. She had met someone. I think that's when she was dating a really cute white guy. And
Hmm.
they were getting ready to engage in sexual activities, and they had never had sex before, and she pulled out a home testing kit. In situations like that, I think it's very beneficial to have in that moment prior to sexual intercourse with someone for the first time, even if it's a fling, one night stand, what have you, no judgment there. But
Hmm.
I think there's advantages of having home testing kits.
Okay.
But what does happen when the test result does come back and show positive? And so oftentimes through the home testing kit program, we have contact information where we can reach out, but sometimes it is hard to contact someone afterwards. And so we have to wait and rely on them to be able to contact back or be able to find resources. So they're provided information, but it still takes that step to come in and either seek care or follow up for
Hmm.
additional testing. And those are sometimes where the fear comes into play, and we may be um, missing individuals who may be out of care but may be testing positive and hasn't seeked care as of yet. And
Hmm.
so I can actually remember a call that I received from um, someone who found us online, and knew that we were a trusted resource, had taken a home test kit, and it was, maybe 2 months after, but they finally did reach out, and we were able to connect them to care. They were actually referred them to AHF here in Orlando. And I think it takes time. Pregnancy test and COVID test is very similar, where There's like a litmus test in it. You see the
Mhm.
fluid run up and then the lines come, after about 15 minutes. And so it's very beneficial to have, but it can be scary, and we do have to
Yeah.
provide resources. And so um, they're given, telephone numbers, contact information, addresses, and we do try to follow up and see how those patients are, or those clients who are seeking home testing kits. And so there is a process in place, but I think there are some areas of improvement because
Mhm.
there's still a fear factor of
Heck yeah.
a new diagnoses. Even when you're in a free testing center, say for example, and you're getting tested and you're sitting there with someone, there's still a level of fear. Every year when I get tested, like, oh my gosh, hope it's gonna come back okay, because you just never know. You
You
never
know,
know.
I don't know, and that the name of the show that Gabrielle Union was on is Being Mary Jane, so we can thank Lamont for that. 'Cause I drew a blank too, sis. I drew a blank too.
Yes, but
Uh,
it was such a profound
yeah.
moment, and I was so excited
Mhm.
because I love that show. And even different, like, other media outlets, that they share these things, that I feel like home testing kits are very beneficial in that moment. And the thing is what would happen? No one has ever, I've never seen it, but what would happen if a home testing kit was positive before you're in the heat of the moment wanting to engage in sexual activities? How would
Wow.
you respond then? And I think that
That's a good one. That Dre. Wow.
that would be a different perspective, right? Like, would it halt
Would
you
it stop you?
from
Yeah.
moving forward, or would you, still stay with this individual? Would you help them? Where would you go? Would you go to the emergency department? But I think having that step prior to, and doing the testing prior, would really help reduce, transmission, because now you can be proactive. If that couple wants to stay together, still continue to date one another, then that's when PrEP would come into play.
Mhm.
And PrEP allows for love in families to still exist among individuals in treatment
Mhm.
who may be living with HIV. So that's the beauty of treatment and prevention. So thank you so much, Lamont.
Oh yeah, Lamont is our producer and soon to be her producer as well. And I think that's going to be wonderful for what's about to happen. I'm this is the kind of support that I love seeing amongst Black women. When you can straighten out your sister's crown, when you can offer up a gown, or you can offer up strapped on heels. So, and I'm just using metaphors, but I'm saying when you can support your sister standing right next to you, that's what we should be in the process of doing, and that's what I love about our relationship. So again, if you're just coming on with us, we're having a discussion that is basically done in the dark. The act is done in the dark, but the conversation needs to come to the light. Truth is truth, and Let's Beehive is an event that supports the truth. And this Sunday, March 10th, over at in Lakeside. Come on and help me with that. Where are we doing this event? It's in Ocoee, Lakeshore Drive, the Lakeshore Center. Thank you very much. Um, and it is a free talk about your event. It is a free event, but you can purchase sponsorship. There's so many ways that you can support Dre on this drive to end HIV.
Yes. So the event is still open for tickets and registration. We have a free option for individuals who may want to come. We're funded by the Florida Department of Health, so we always make it open to the public. But we also have VIP tickets for preferred seating. And then we also have our sponsorships. It actually just closed because we're in the process of getting everything printed. So we are still accepting sponsorships, but we won't be able to have your logos within the program book and on our step and repeat banner. But we still are
But,
accepting
but,
donations.
but
Yes,
here's what we will do.
yes.
I'm the moderator. So here's what I will do. I will repeat your name and bring attention to your name from that podium. So you won't lose a thing. You won't lose a thing. If you are interested in sponsoring, go ahead, Dre, and tell them to come on and do that, because this symposium, dinner, and fundraiser is going to be fun. It's going to be informative, but it also helps to further the education that Dr. Dre provides around the country. And there's something that we are going to embark on, and I'm putting it into the universe, and that is conversations on HBCU campuses. We definitely want to do that, and we pictured it in everything, but we have got to. Dre's gotten busy, and so have I. But it's a conversation that's necessary. On April 13th, Dre, I want you to see if you can support this over at CB Bistro. I'm inviting 40 high school senior girls who are about to go off to college. And the conversation is going to be all the things that your mom just didn't tell you. And
Mm,
the conversation is going to focus on sex and drugs. It's going to be led by a guy and a girl. So it'll be, you know, intimate in the sense of this is what happens. We're going to talk about campus safety. We're going to talk about the divine nine. Should you or shouldn't you pledge? And what are the benefits? And what are the drawbacks if you don't get accepted? There's trauma that starts then. I also wanted to have one other conversation was going to be on finances, how to stay out of debt. And when I say
mm,
that, I mean your freshman year, you are enticed by everything looks, shiny. Even that freshman 15, we got to have that healthy nutrition discussion too. But all of
yes.
this is going to be over a luncheon, and we'll have a variety of speakers. And it's not going to be long sessions, they may be 20-minute discussions, but
Mm,
then you have access to that person afterwards. So, again, that's going to be April 13th over at CB Bistro. And we are going to have a conversation for the moms at a different time too, because we do need to get them up on the conversations that they need to uh, have, especially with their girls. And I always say that guys need to know too, but the girls need to know for preventive measures. Um, yeah. So that's what I wanted to say.
mhm,
So March 10th is Sunday, and that is over at Lakeshore Drive, the Lakeshore Event Center. The annual Queen Bee event. It is our eighth one, and HIV awareness is what this is all about. March 10th is National Women and Girls HIV Awareness Day, and we find it not robbery to do it year after year just to introduce you. And then this year, the topics are going to center on, go ahead, Dre, women and how do you disclose and what their children feel like if their parent is positive.
And then also one really thing that I'm most excited about this year is we're actually incorporating a memory wall where we can commemorate the parents of the
Mhm.
children who's lost their parents
Beautiful.
to HIV and AIDS. And I think that, or complications associated to HIV and AIDS. And, it's really important oftentimes too, if you hear, oh, my mom or my dad has HIV, that naturally people are still, I think, in a level of ignorance and think, well, if your mom had it, then that means you have it. And really kind of understanding it's not necessarily
Yeah.
genetic that way. It just as far as understanding modes of transmission, and
Hmm.
sometimes parents can be diagnosed after the child was born and has nothing to do with the
Hmm.
pregnancy prior to, and it's just a lot of layers that we really want to help uncover from this different perspective. And so every year we really try to focus on different ways that HIV can affect women and also children. And so I'm super excited to be able to have two youth panelists as well as three adults. So there's a
Hmm.
group of five. Even though they're not children now, the adults can still share their perspective and how they've learned how to bloom where they
Hmm.
were planted and overcome adversities in order to, see what they're doing now. So I'm super excited about that. And also with the memory wall or the memory memorial section, each panelist has been able to write a love letter to their parents.
Mm.
I'm super excited about that and to be able to still be connected in some way. But I feel like the parents need to be recognized, and just spread love even to the children and families who may have lost loved ones to HIV.
Mhm.
So I'm very excited about this year's Queen Bee event.
What is next for Dr. Dre? Because I know that this Let's Beehive is a love of yours. It's a passion for you. I mean, truly a labor of love, and you're very passionate about it. But you do have your podcast. We can talk about that. But what's next for Dr. Dre that you can talk about?
Yeah, so I'm in the midst of a few different things. I feel like I always keep my hands, you
But
know,
that's good, Dre. That's good. Yeah.
I really love working in non-traditional spaces to help increase HIV awareness and, really bringing it into a positive light, very optimistic and uplifting and loving. And right now, I'm in the midst of finalizing a contract in order for us to really be able to duplicate some of the things that we're doing here with our She is Purplicious program and get outside of Orlando, Florida, and do things across the state
Mhm.
and possibly in Atlanta, Georgia. So I'm very excited about the opportunities that are coming. I won't say the name right now just
No, no,
because
no. Mhm.
we're still underway with creating and finalizing the contracts and everything. But um, I'm very interested and happy about getting things on the road. My book is going to be coming out soon as well. I've
Hey,
been
Dr. Dre.
so busy with that, but I am writing actually two books right now. She is
Well,
Prepalicious, and it's going to be for women and girls. It's a 7-step HIV prevention guide for women and girls. And I'm also writing a book for healthcare providers to be able to understand the importance of PrEP and how they can prescribe PrEP for women, because those are two barriers right now that's preventing women from getting PrEP.
mhm.
Um, and I would say those are the two big things I feel like this year. And to speak on the college tour, maybe this opportunity with this contract is something
Yes.
that we'll be able to do. And then we're also going to relaunch the second season of our Stinging Stigma podcast this year as well, which I'm super excited about. So,
Good.
so many great things. And, we won the Preppy Award from the Biomedical Prevention.
Yes, congratulations on that. I remember when you said that you were going up to present.
Yes, we won first place. And I was so excited. And that was for our She is Prepalicious campaign as well. And, I really want to see this take off and really create a way of support for women. One thing that I feel like in the future of where we're going, where are the support groups for people who are HIV negative? Why
Mhm.
is there only so much support for individuals after a diagnosis? And so we're in the works of creating that. I've never heard of it, and I'm always trying to figure out where are the gaps and what can we do to solve that. And so that will be happening this year with this contract. We'll be able to create that and to be able to expand and create a network of support um, through virtual and through technology. So I'm excited about the opportunities for Let's Beehive and where we're going. And I just really hope that we can end the HIV epidemic. We'll never be able to get to zero if populations who are vulnerable and need help don't have the support. And then also with other populations, I mean, HIV doesn't discriminate, and we have to get to all populations. And so we're trying to help fill those gaps. And so that's my goal.
I actually muted because they were doing some lawn work, but I wanted to make sure that we were actually on point for this Sunday to also make sure that we understand that this is a disease that affects everyone in some kind of way, whether it's your neighbor, whether it's your teacher, whether it's you. We have got to get to the point where openness and discussion and just next steps are just more prevalent and available. Now, that means that you're going to have to be the one to open your mouth. And sometimes that's the hard part. So if you'll go on Dr. Dre's website, and we've been showing that all afternoon, all the entire discussion, but you can reach her at the website is letsbeehive.org. Let's be HIV. Let's BEE HIV. Let's be HIV.org. So just go ahead and make sure that you go there. And one of the things that you said that really, really moved me was the fact that someone did test at home and then looked up your organization, and you were able to talk them through what their next steps should be and could be. Many of us have friends and just people, as I mentioned, who are HIV positive. Some may have disclosed and some may not have. But all in all, this is something that we're going to have to live with. But when I introduce you to Raman, he seems to think that there is a final point to this disease. And I think the level of research that you're putting in with your partners, I saw one of your partners at an event maybe 2 weeks ago. And I just think it's when I see women of color doing it, I'm just so excited. And I thank you. And I thank you on behalf of all women, Dr. Dre, because this was not something that is actually going to increase your pay raise on your job. This is something that you became passionate about in undergraduate, then went on to graduate, and then in your pharmacy studies. And you decided that this would be where your level of expertise was going to reside. And we're grateful for that. And especially with you being an HIV negative person, I'm sure people wonder, why is she so involved in this? I mean, that could be a stigma. Do you ever get that stigma?
Oh yeah. Oh
Do
yeah.
I just thought about that. Did that ever occur?
Yeah, so
Like,
through our Stick and Stigma HIV prevention program, we actually talked about and helped. That was a support group we put together for women and youth who are living with HIV. And we created a support group for them. And we talked about the different levels of stigma. And there's internalized and externalized stigma that I feel like are the two most common that people talked about. But there's also stigma by association. And because I'm associated with Let's BeeHIVE and the organization, and most founders are affected in some way or maybe living with HIV, I do get that a lot. And it's almost taboo for people to understand, well, why do you care about it so much? That's because I'm an African American woman, in my age group right now. I mean, I'm in my 40s, even though people probably don't believe that, but you know, I'm in the population who I'm trying to help with the prevention. So if I'm
sure.
trying to help other people, like I have to walk that same walk too. And so I wanted to be able to help share with the information that I knew as a healthcare provider, like why don't the lay people know this information? And then for PrEP to be out for so long, since 2012 for prevention, and we're 10 plus years out, why don't people still know about it? And so these are some of the things that are alarming. When I'm, in the hospital, we have a syphilis that's going wild right now and other STIs. What do we do about that? So I'm excited about it. I get excited that you're excited, and that helps other people understand the importance of this disease and of this topic, and even of just sexual conversations in general. It's, we all got here and we're all living here because somebody had sex and we were born and we're here.
Yeah.
Like, it's a very natural process in that circle of life that I feel like you can't really avoid it. Eventually, this is going to be a topic where our youth need to understand. So as they transition from young adulthood to, I mean, in their youth years and transition
Mhm.
into adulthood, that they, will have learned this information. So I'm super excited about your upcoming event on April 13th, and hopefully my schedule allows it. If
I
I don't
know, because
figure it out.
yeah, I know, I know, I know. Let me ask you one last question.
Yes.
How soon is too soon to start the discussion about HIV and sexuality?
This is a very common question. So, I'm board certified in pediatric pharmacy, and I've worked in pediatrics my entire career, the last 14 and a half years. And this is a very common question.
Mhm.
And I feel that parents, once puberty starts, so that's typically around 11, 12, 13, middle school years, are really what I always recommend would be the best time to start the conversations. And it's layered. It's not just like a one-time thing. But once they're starting to feel different hormones, their bodies are naturally changing. Once a young lady gets her menses at 11 and 12, her body is ready to receive a child, and just really
Mhm.
understanding what changes are taking place inside of their body to understand what these things mean. And I think it's very important because that's that reproductive cycle that's starting to develop at that time. So mentally, we have to help families understand that we have to start those conversations. And this is why I truly believe we see rates of teen pregnancy. And oftentimes, family just feel like, oh, well, I'll just put my child on birth control and that's going to be a band aid. But it
Nope.
doesn't necessarily mean they're not having sex, even though there's no babies. That we have to really get into, maybe I'll start birth control and prep for my daughter, or making sure my son, is on prep. These are the things that I really would hope to see in the future as well, is making sure that we keep that family oriented nature. Um, but it is so, so important to make sure. And oftentimes, one thing that I've realized as well is that parents aren't capable, or they may not feel comfortable having these conversations. And so that's a service where Let's BeeHIVE, or even Let's Spill
Yeah.
the Tea, can come and create those safe spaces where they can learn the information. But I would say as young as, I mean, the youngest we've educated in the community was probably 10 or 11.
Mhm.
Um,
I do wanna say this, Dr. Dunn has an office that is open every day, Monday through Friday, 9 to 5, right?
yes.
What is your address? It's right off of Kirkman, and you can stop in, you can get the information. Dre, put it in the chat so we can pop it up um on our deck here. But I forgot to say that earlier so we could be prepared with that. But there is someone that is always there, 9 to 5, and you can, like I said, get information. There are even resource rooms inside her office where you can actually go and have a meeting there. And the person who is on duty at her office can lead you through discussion. So I do want to say, make sure that you utilize the services of Let's BeeHIVE. Um, in and around town, whether you see her or not, she is always available for you. And it would be through her 773 Kirkman Road, Suite 120, Orlando, Florida, 32811. So we have to put one more seven on that deck. But I just enjoy talking to you, Dr. Dunn. We're going to look forward to seeing you this Sunday again at Lakeshore Drive. It's so amazing every time we get together. We have Dre will call me, and our conversation, or I'll call her, and our conversation, thank you, was supposed to center on one thing, but we will an hour later have figured out, world history and just, discuss everything. So our friendship is what is so endearing to me, but just the fact that this young sister is so smart, and she's willing to share her smartness with all of us in the effort to curb the epidemic of HIV. So, Dr. Dunn, we look forward to engaging with you again, and I thank you so much for being on One Take Live with us today.
Oh, thank you so much, Monica. I love you, girl.
I love you back, and make sure that you can share this conversation on Facebook as well. Also, you can go to our YouTube page on Monica May Communications. And again, we're loving the fact that we are on Spotify. I am so grateful to my team for moving this show forward. So thank you all once again. Again, it's Monica May and One Take Live.